gwenge mago e kaunti mabei mabende kwethno mar Gen Z osebedo ka ng'anyo en nino mar chanjo e nyeto mag nyithinde ute thieth mag piny owacho pod medo kelo midhiero ne jonyuol kod nyithinde counties mopogore opogore jumbe ariyo bang' piny owacho singo ni chanjo go osemol e pachoka e kaunti ma Bungoma. Moko kuom jonyuol ywak ni chuno gi wuotho e ute thieth mag ji giwegi mar manyo chanjo ma giwacho ni nengo gi ni malo kalure ni gionge kod okumba mar thieth. Moko kuom chanjo ma giywak ni onge oriwo mar kahera, polio, DTB kaachiel kod hepatitis B. Motelo ne ma piny owacho nyichoko ni gisekelo chanjo mane ongeromo shillings bilion 1.25.
The problem we are having with the vaccines is that when we want to opt for the government, especially for the parents who don't have like covers or that financial capability to visit the private institution, when we go to public hospital for the vaccination, we are not able to get all the services that are needed. Sometimes you are able to get half of the vaccines, like KP. Those normal injections are there, but these other things like rota or any additional services like that influenza is not readily available there. So you find that our children are really coughing, they are suffering with the flu. At least they try and work in the safe margins with the minimal taxation so that we can also be able to enjoy being in our country.
The trends that are going on with the finance bill, and you see most of the people, we are in the low level income. I think most of the people will be affected since there is no that income generating agents that will help them, since the taxes that are going to be imposed will lead to people